planning for disasters.
It's so important because you don't expect for these things to happen.
And teaching how to prepare.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
There's the valve.
All of them together.
And which was healthier, the yogurt and the bagel?
All right, I'm going to start by measuring the size of it.
You could also add grilled chicken to this recipe.
Blow hard! Blow, blow, blow! Keep pushing!
Just your head.
Pull red handle to open bag.
Hello and welcome to On Call. I'm Tammy Watson. Coincidences happen. For example, the focus of our show tonight, disaster prep in South Dakota, was scheduled long before rising Missouri floodwaters came to dominate the headlines. But the fact that the topic of disaster preparedness has turned out to be so timely could be seen as an example of the fact that discussing the what-ifs of disasters before they happen is a good idea, because sooner or later, disasters will happen, just like coincidences. So in our show tonight, we're going to take a step back from the current emergency situations in our state and talk about the planning that healthcare providers, government officials, and others put forth in order to protect South Dakota citizens and communities from disaster. We'll bring you stories about specialized disaster preparedness training for healthcare professionals and about ways to prevent infectious disease disasters. We'll have phone numbers and website information for those of you who need help now regarding flooding concerns. And of course, we'll bring you a great studio discussion. Joining me live in our studio are Sandy Frentz, not a doctor, Dr. Matt Owens, and our medical editor, Dr. Rick Holm. Sandy Frentz is a public health director for the city of Sioux Falls. They are standing by and ready to answer your questions. The phone number for you to call is 1-888-DOCTOR-ON-CALL. Again, 1-888-376-6225. And helping answer the phones tonight are volunteers from the Brookings Health System. Dr. Holm, before you introduce our guests, I want to know, how has disaster preparedness training for physicians in particular changed over the years?
Well, we typically had no for sure defined training. We just kind of learned to take care of emergencies.
It's evolving.
And it is evolving, and in the last, I think, when there were envelopes of poisoned infection spreading out through our country, we suddenly decided that we needed to know about all these potential biologic warfare agents, and not only did the city of Brookings and the doctors of the Brookings Hospital come together on that one, but the State Medical Association came together on it, and the whole state came together about what do we need to know about potential biologic problems such as that. And since that, we have had tsunamis in Japan. We've had flooding, extensive flooding, and the tornadoes in Joplin, Missouri, that are happening just in this year. Tremendous tragedies, and preparedness is right on the tip of our tongues right now. I have to say, I wrote the editorial or the essay for tonight's show on tornadoes before Joplin. It was just exactly what you were saying. It's this. Isn't it a coincidence? But we kind of thought that there's potential problems for disaster, and that's why we called Matt and said, let's set this up. And I think we delayed it a time or two.
Yes, we did.
And we landed on this date, and isn't that something else? So I'm happy to introduce to you our guest for this evening. Sandy Frentz is the public health manager for the city of Sioux Falls, And Dr. Matt Owens practices at Community Memorial Hospital and Redfield Clinic in Redfield, South Dakota. Dr. Owens has a special interest in disaster preparedness, has been on this show several times for that very topic. You were my resident when you were doing your residency, while we were doing a residency program in Brookings.
I remember it well.
And good friend, and I think my mother's watching because she knows you're on and she's your good friend.
That's right. She used to help me pick out my ties.
Yes, yeah. Well, Sandy, tell us about what you do and what your training was and where are you from. And
well, it was kind of a long and twisted road. I started out in lab. I was up here at school at SDSU, and I spent a number of years working in the lab for the health department with the city of Sioux Falls. And then people got that wild idea to mail anthrax letters, and emergency preparedness really started evolving in the field of public health. And I'd finished up a master's with a safety focus, and it just kind of all sort of fell under other duties as assigned, and it fell to me.
Yeah, that's great. Well, we're pleased to have you here.
Thank you.
And Matt, you know, you're a guru now, actually nationally in this whole field.
I think guru probably really overstates the case. But,
okay, all right. But you are one of the national leaders, and certainly in the state of South Dakota, you are our leader in trying to get doctors focused into this issue. What brought you into doing that? You're a family physician.
I'm a family physician. My primary job, I'm a family doc up in Redfield, South Dakota. I started my career clear back in '81 as an Army medic, and it's just kind of advanced through the system as such. When you talk about training physicians, I can say that South Dakota, to my knowledge, is the only state that requires training in disaster medicine for a variety of the different medical students, nursing students, etc., and then also makes them deployable. And part of the reason how that works is the state sovereign immunity laws, integration between the South Dakota Medical Association, South Dakota Department of Health, and USD Sanford School of Medicine. It is an evolving thing. I think we're on the front of the curve nationwide.
That's great.
Yep.
Well, we need to talk about it, and we need your questions. This is a very important topic. Anything you can think about, give us your call. We'll talk about it right after this.
Flash floods often bring walls of water 10 to 20 feet high.
If you follow the news at all, you know that right now the Missouri River is showing all of us that Mother Nature gets the final word. As riverside communities prepare for flooding, some small solace can be found in the fact that some South Dakotans have already put time and effort into learning how to respond to disasters like this one. Way back in February, the South Dakota Disaster Preparedness Training event was held at the University of South Dakota. It was a cooperative effort that involved the South Dakota Department of Health, the South Dakota State Medical Association, the Sanford School of Medicine and the School of Health Sciences at USD, South Dakota State University, the National Disaster Life Support Program, and the Yankton Rural Area Health Education Center. It should give you a good feeling to know that students and individuals from across South Dakota came together to learn and prepare for the disasters that our state may someday face. In February, hundreds of students, healthcare professionals, and educators came together at the University of South Dakota. Their purpose? To improve their knowledge of how to prepare for and respond to disasters. Dr. Lewis Marshall, chairman of the Department of Emergency Medicine at Brookdale University Hospital in Brooklyn, New York, spoke at the event.
I do a few of these a year, mostly on the East Coast in New York, and this is the first program that I've seen where they're actually teaching a large number of students, medical students, nursing students, and I think that South Dakota is way ahead of the rest of the country in this aspect in training students in disaster response and preparedness.
A strong and prompt local response to a disaster offers benefits that don't come to communities that simply wait for help to be delivered from miles away.
In the event of an emergency, having somebody at the local level who's been trained is really the way you want to go, because they're ready to go. And as we know from all of the disasters we've seen in this country, all response is initially local. It's the local health community and the students that really have to step up and respond to the disaster. So whether it's an influenza or flooding or some other disaster that we need a lot of people to respond to, it's going to be a local response.
To further clarify what is necessary in regards to an effective local response, Dr. Matt Owens from Redfield, South Dakota, explains more about what the word disaster actually means.
One of the things that we have to look at is the words we use. We talk about disaster, and immediately people think about 9/11 or Katrina. And really a disaster is when your needs or the things you need to do for those patients exceeds what you have locally available. Well, that's not an uncommon occurrence in South Dakota. So these students are trained on how to respond to not necessarily the Katrinas of the world, but let's say multi-car accidents. How do you triage people? How do you train them?
Deanna Lassegard, a nurse and paramedic from Rapid City, South Dakota, is one of the people attending this event.
Oh, it's so important because you don't expect for these things to happen. You need to plan ahead of time and have things set up and prepared, because at any point in time a disaster could happen. And when you have a group of trained individuals, especially from multiple disciplines like we have today with medical school and nursing and PAs and social workers and things like that, we've got a team that's ready to deploy within South Dakota for any disaster that would happen.
South Dakota's Lieutenant Governor Matt Michaels also attended this disaster preparedness event, and he says South Dakota should be grateful to those who participated.
Well, I was asked to come and talk with the students about what we need in South Dakota, and also thank them for participating, along with the organizations that are collaborating. I want to make sure that the young people who are here of all disciplines understand that we need them in South Dakota, we need them in service, but also thank the individuals and the organizations for collaborating, because a lot of states don't get this type of cooperation. We really have to work as a team, whether it's nurses working with pharmacists or occupational therapists working with physicians of all sorts of backgrounds. The one goal that everyone has is service to others, and especially those in need.
Very quickly, I want to say thank you to Chad Anderson and the production crew at South Dakota Public Broadcasting for helping us with that report. Now back to the story. Ms. Frentz, Dr. Owens, you both attended that event. What more should we know about it?
You know, I think it was a wonderful event. It was very multidisciplinary. We had social workers and OT and PT and med students and pharmacy students, and
they got lieutenant governors.
And lieutenant governors.
There really were hundreds of students and people there?
There were, and they were given a taste of a lot of different responses, you know, whether it was the strategic national stockpile, or we learned how to use Mark I auto injectors to which you would need if you had a chemical agent exposure, or triage tags, or
auto injectors. Those are the shots that blow through the skin, right?
Right.
Yeah. Okay. And in South Dakota, excuse me, I don't think it's going to be a nerve agent, but it may be pesticide. Sure. And that we brought those sort of concepts home, that you train for an all hazards approach, and it may or may not be a terrorist. It may be just something that happens within your community. To clarify that question, we had over 300 students, but of note, and this gives you an idea about South Dakotans. Over 90 of those students signed up to be deployment ready under the ServSD program.
We're going to talk
almost
about
a third.
The ServSD. We've got the website later, but yeah.
Oh, we're going to do that later?
Well, we've got the website later, but tell us what it is first.
ServSD.
ServSD is let's go back a little bit. One of the problems that they had in Katrina, they had all these well-meaning people and some not so well-meaning people came to, quote, help. They did not, they could say they were a physician. They didn't have any knowledge of this physician's capabilities, whether they were, what they're able to do, nurses and other health professionals. And so what has happened in South Dakota, we have a sovereign immunity law for those folks that sign up under ServSD.
Which means?
It means if you're deployed under the governor's auspices, that
you're not liable.
You're not liable as long as you're doing what you're supposed to be doing. Right. Now, if something criminal happens, that's a different story. But anyway, you get pre-registered, so we know that, let's say, Rick Holm, an internist from Brookings, could probably cover an ICU pretty well, and if we needed that sort of physician moved to, say, Watertown, they already have all your information. They already know who you are, what your training capabilities are, and it's a great resource.
Now, I signed up for that thing. You put my hand behind my back and squeezed.
Absolutely.
And I signed up like 6 years ago, but I haven't heard a thing. Does it mean that I'm off the list?
Nope, you're still on the list, and there will be some updates, I think, coming down the line. Even as the medical students matriculate, we'll need to pick them back up as interns, and like the PA students, when they come back out, we'll need to update that sort of stuff.
Okay.
But yeah, you're on a database.
I'm going to dive into some of these websites and we'll cover ServSD. So before we go any further in our discussion tonight, we want to let you know about some of the web addresses and web-based resources that state government has available in regards to disaster preparedness. One website that addresses many of the immediate concerns about flooding in South Dakota is disasterrecovery.sd.gov, and you should be able to see that address on the screen right now.
And what's at that site?
On this site, you'll find links to aerial photos of the Missouri and Riverside communities, maps that indicate the forecasted levels for how high the river will rise, news releases, and other up-to-the-minute information about disaster recovery in South Dakota. Another website that you can check out is BeReadySD.com, and this is the website to go to before a disaster hits. It has information about how to plan for and respond to emergencies that might hit your family and your home.
So if
and final, let me finish up here. Okay. The final website, the one that we were just talking about, ServSD program, can be found at https://volunteers.sd.gov, and this is the home site for the statewide emergency registry of volunteers in South Dakota, and you can go here to sign up to serve as a volunteer in case of a future emergency. You'll be asked to register and provide information about your experience and your qualifications. Can you operate heavy equipment? Are you a retired nurse? The answers to those type of questions will help emergency management personnel determine how you can best serve your community in case of a disaster.
Sorry to interrupt.
Nope, that's fine. So ServSD isn't just for healthcare professionals.
No, you used the terms earlier. It's all about all hazards response. You know, you don't want to train on just tornadoes and only tornadoes, because then if it's a flood, you know, the steps may, well, or the steps may be the same, but you don't necessarily apply them across because you want to look for a different plan. So you want to look at all your preparedness with an all hazards approach. So you're kind of ready for whatever gets dealt to you.
And all hazards.
I'm going to add back to this. Absolutely, it's not just for medical people. There's a definite need for mental health services, clergy that's trained in, you know, just things like stress management, that sort of thing. Absolutely.
What if you have no apparent skills like me?
Oh yeah, that is
but you can still sign up, right?
Oh yeah.
Yeah.
Okay.
You can. So we can have you fill sandbags.
Yeah,
there you
go.
go. Okay.
You know, and you want to have your volunteers pre-registered because that way we know who's coming. We can access you if we need you. You're pre-credentialed if you're a physician, and it's kind of dangerous to have just spontaneous volunteers showing up, because it's a little harder to control your scene. You don't know who's there and what they're doing. So you always want to keep your volunteers registered, and this is a perfect opportunity.
Control your scene. Now, that's a good term. Tell us about that.
Well, let me just say, for example, in Katrina, we keep going back to that.
There's a lot we can learn from it.
Right, and they had a lot of people that weren't physicians acting as physicians. They had people that said they were nurses. They weren't nurses. They had con artists. They had all sorts of basically undesirable people. So when you have
not all of them were undesirable. There were some good people there.
No, yeah, great, yeah, I understand, definitely. And then there's a lot of people that showed up to help. But if you're not on a response plan, instead of being a help, let's say if you went to Katrina to help, then emergency management has to find a place for you to stay, a place, something for you to eat, and they have to take care of you also. So volunteers that are not on a specific mission, I guess would be a good way to put it, are more of a hindrance than a help.
Might be hanging out there and not having the help that they need, the food to eat and so on and so forth.
Yeah.
Okay. I want to go back to that Be Ready thing that I was trying to interrupt you for. I'm sorry. You were on a roll, Tammy. That was great. Be Ready. Tell me about that. I mean, that's for people who are trying to get ready in their household for fire, or what kind of a scenario?
Well, I know they have checklists that for kind of, you know, what should I have at home?
What should we pile in the basement?
Exactly. Yep.
How many gallons of water per
that kind of stuff.
person?
The special things you need to think of. Do you have a child in the house? Do you need formula? Do you need diapers in that little stockpile that you're creating? Or do you have prescription medications that you need to think about? It has a lot of tools that help you think about what do you need to do to just be ready.
Right. And my question is, though, how do you know how long it will be? Does it recommend, do they say you should be ready to be completely isolated and make it for a week? Or
I would say in general, kind of the mantra I've heard, the first 72, 96 hours you're on your own. I think that's probably a pretty good rough estimate for this part of the world.
Yeah, so you can get help after 3 days, but you've got to be able to cover yourself for 3 days, stuck in a basement, no food and water. What can you do?
Exactly.
When I was a kid, you'd go to the grocery store, no bread, no milk before storms, winter storm. And this is a good reminder of kind of getting back to that mindset where, okay, I'm going to be at home for a while.
Yeah. Well, you can store dried milk.
Yeah.
But you can't store that wet stuff, and you can store flour and maybe crackers, but not bread.
Tuna in those foil pouches is a good thing, I guess.
Tuna in foil pouches.
Not in a can.
My children are really into ramen.
Yeah.
Their ramen is a great
ramen,
thing.
you could probably live on it for a lifetime. not well.
My kids love ramen too.
Yeah. All right, well, we're going a little far afield here. Now, there's stuff happening right now out in Pierre and down along the Missouri. Are there things that we should, kind of be aware of as far as like some of the planning that went into the preparedness for that?
I would also ask, I know that there are a lot of volunteers that have gone out there. And I know they called for physician volunteers. And I mean, my scheduling person said, nope, you can't. No. And I'm going, my peer friends are in need, and I haven't fulfilled the bill. But the question is, a lot of people have gone out there to help. I know that. Do we have any numbers, or do you have any ideas of what's happened?
I don't have any numbers on that, but what I can say, the South Dakota Government Department of Health, Preparedness, those organizations have really done a great job of keeping that information stream open. And I do believe it's correct to say that just wandering out to Pierre probably is not the thing to do.
But to call the health department, huh?
Right, or call, I think a lot of it's actually being done through their the Pierre City Chamber of Commerce.
I was going to say the communities come up with it, and the acronym is VOAD, but it's volunteer organizations active in disasters. And so whether it's a VOAD, which is what we have in Sioux Falls that coordinates things, or whether it's the Chamber of Commerce in Pierre, some of this is driven by the event and how large it is. But they do the volunteer coordination and registration, and a lot of that need really is determined through the whole incident management process, if you really want to talk about it. And that's really the planning process. It's a management tool, and it's people that sit back and say, okay, what's happening? What do we need to survive the next time period? Is that 12 hours or 24 hours? Right. And then how do we support what we need to do to get that work done? And volunteer management and personnel are part of the resources that come into any disaster response.
So, and that's really answering Tammy's question of what do we need to know. So this is called incident management. In other words, there's courses taught about having somebody coordinate.
Yeah. It's called incident command, and the best way I explain it to medical students, it's how to organize chaos.
Well, what do you learn in those classes?
Well, in the backdrop of it, it's interesting where it came from. In California, I believe it was in the 40s and 50s, they'd have these forest fires, and one truck would be going that direction, it'd be passing another truck to go a different forest fire because there wasn't one central command and control organization that was sending fire team A to the closest fire and then providing the support to keep that fire team going. And I believe that's where a lot of the early research came out.
Incident command.
Yeah, how to control everything from operations to logistics, how to pay for it. Yeah. Funding.
And a lot of this has come through our fire departments, haven't they? I mean, that generally the top echelon of the command is the fire department people, generally, or
that's commonly. A little bit event driven too. I mean, if it's a public health event, you're going to have a public health person as in your incident command, but fire has by far the most experience in it. And now actually under, is it Presidential Directive 5?
Yeah, it's either HP, not to get too specific.
But the federal government has really come down and said that when you have an event, especially if you want federal reimbursement for your responses in that event, you have to use the incident command system. So it's something that healthcare has been really working on the last number of years, because it's applicable whether you're managing a wildfire or working with a multi-vehicle car accident or planning a wedding. I mean, it really, no matter what you do, it's just all about having control and command and watching your resources.
And back to like the incident command, that's a very fluid thing. It isn't necessarily one person sitting in one chair, not at all. And who's in charge of an incident at the beginning is probably not going to be who's going to be in charge at the middle and the end.
But I have seen times in the emergency room when you need an incident command. Mm-hmm. And I was thinking I was in control, and someone else comes in who's not on call. And they're in control, and I thought, who's in control here? There should be I should be making the calls, or I'm just giving you an example of sometimes there are people who take charge when they haven't been given the responsibility. I've seen that happen. Go ahead. I'm sorry.
Well, I was going to say I want to pick on the physicians here. Now, if people have watched the news like I have, they saw the images in Joplin, Missouri, of the hospital that the windows were all blown out, and I'm wondering if you either have heard stories about how they managed with dealing with patients in a situation like that, or how your hospital is prepared to deal with a situation like that.
One of my friends who works at the hospital handed me a 5-page story, running monologue of a written note by an ER doctor. Did you guys see that?
Yeah. No, I haven't seen it.
And it said he was talking about the being hit, knowing he's working the ER, and suddenly it's coming, and he crawls under a table with a pregnant nurse, and the two of them wait for it to hit, and the lights are out, there's 3 feet of water in their ER, there's 14 flashlights, people are coming in like crazy with, primarily, get this, glass flown into their face and into their chest, and one guy's got a pneumothorax, and I mean, the important lesson I get on that is get away from glass. And just the craziness and the support that he had during this time is an amazing story.
I think what you're kind of alluding to is triage.
Okay.
And it really means to sort. And there's been a lot of different systems over the years. And over triage is just as bad as under triage, because if you're using resources up for folks that don't need immediate life-saving care right now, somebody down the line is going to suffer for it. So there's a huge body of literature out there on appropriate ways to triage, and that's exactly what you're talking about.
Right, the really, really sick ones go to this place. The not so sick go to this second place. This is part of that. Someone's triaging and getting these people, and then this group of people are responsible for the very, 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 very sick.
And unfortunately, you also have to use the term expectant.
The ones that are going to die,
no matter
don't waste your time.
Right.
You love them and care for them.
Right.
And you're sorry,
give them some morphine, keep them comfortable.
And there's a smaller group of people taking care of those.
Yep.
But it's a classic story of the coming upon a car wreck. 3 guys are out there. One guy's laying there, is almost for sure going to die. No matter what I did, he was going to die. The second one was screaming bloody murder. Got a hurt in the head. He's just demanding my time and in my face, and I've got to help him.
He can wait.
And he can wait. He's fine. He wants my attention. The third one is laying there and he's shocked, but he could recover. And there's something that needs to be done. And I'm there to be able to help that guy. That's the best use of my time. So I tell the guy who's screaming to go over and take care of the guy who's going to die anyway.
Yep.
And then I take care of the one I can help. That's triage. With limited resources, you give your help. And that's what we have to do in an emergency situation like that.
Great illustration. That's a great story.
Mm-hmm.
Okay, well, I'll interrupt then, and we'll go back to tape. Now, as you know, disasters come in many forms, and infectious disease outbreaks is not what we're focusing on right now, but they need to be considered alongside the headline-making floods and tornado emergencies that seem to get top billing this time of year. On Call met with South Dakota's public health and infectious disease specialist, our state epidemiologist, to talk about disaster preparedness and disease. Lon Kightlinger is South Dakota's state epidemiologist, and he specializes in understanding how diseases spread through human populations. According to Kightlinger, the burden of preventing the spread of infectious disease is a shared one.
It's half personal responsibility and then half societal responsibility. Part of what the health department does, at least for the vaccine preventable diseases, is we have mandated guidance for school entry vaccines, and vaccines kids need to go into daycare or colleges. And these have kept our numbers down with these vaccine preventable diseases.
Kightlinger and his colleagues at the South Dakota Department of Health know that there are a number of vaccinations recommended for children. And Kightlinger says parents should make a point of working with physicians to stay on top of childhood vaccination schedules.
And then when you get to be an adult, you're almost home free, but still, every 10 years you should have a tetanus shot. And that's good for disaster preparedness, because if we should have a flood or an earthquake or a tornado or something, and you're injured or you're out cleaning up afterwards and you get yourself poked, you don't want to get tetanus on top of all your other personal crises.
Older adults are also urged to consider vaccinations for pneumonia and shingles. And while vaccines are powerful disease-fighting tools, Kightlinger says there is more to preventing the spread of disease than just good vaccination rates.
That's probably the number one, along with just good personal hygiene. And that means, part of the government-sponsored infrastructure of safe sewage, clean water, pasteurized milk, but a lot of it has to do with your own hygiene, what you do in your own house, how many times you wash your hands, take a bath, clean up after yourself, after the toilet, after you change your children's diapers. These are all ways to protect yourself from diseases.
Tornadoes move at speeds of about 10 to 20 miles per hour, although they've been clocked in bursts up to 70 miles per hour.
Thank you for joining us tonight. We're talking about disaster preparedness in South Dakota, and here in the studio, ready to answer your questions, are Sandy Frentz, the Sioux Falls Public Health Manager, Dr. Matt Owens, and the on-call medical editor, Dr. Rick Holm. Our phone lines are open, and you can call in right now with your questions about our topic tonight. Our phone number is 1-888-376-6225. Now, I do have one phone call here, but did you want to follow up on the infectious disease? Basically, it's vaccines and hygiene, right?
That's it. I mean, you think about it. It says one more time, vaccines are so very important. We cannot let that pass up. And of course, there's all this panic about vaccines causing problems. None of that has any solid scientific backing. The scientific backing is vaccines work. They prevent epidemics, and we just want to make people realize that they're important.
How important is it to keep current with my tetanus shot? Is that
Matt,
like
what would you say?
I'm back to the old U.S. military standard, once every 10 years, and if you have a bad, real tetanus-prone wound, we're gonna bump you up there, right there in the ER.
That's right.
But I really should be watching for it once every 10 years.
Yeah, and they're adding to the tetanus now, what, diphtheria and pertussis.
Yep.
Oh, okay.
So you get 3 bangs for your buck.
If I can jump in here on that, that's an interesting point, because I know maybe 20 years ago, whenever they had a flood, they'd use a lot of resources, time and money, to go out and give everybody a tetanus shot. And now we know that's just not a useful thing to do. So questions this spring when we had flooding up in our area, I just told my patients to make sure your tetanus was up to date, because it should be anyway.
Right.
Yep.
Have you had one in 10 years?
Yep.
And by the way, diphtheria is something that can occur in flooded areas.
Really? What's the tie in there?
Infection, the dirty water.
Okay.
So the other issue is that it's just a good idea to get that, so that when but if you come in because you have this cut, or you ran a dirty nail through your hand or your foot, and that's the other thing. Think about it. When do you run your foot through a rusty old nail? When there's flooding and there's floating panels of debris with nails in them, and so it's a time to get that shot, to make sure that you, if you need it.
Okay.
10 years.
All right. We have a question that came in, or more a comment rather, from Brandon. Why not mention CERT, Community Response Team? And the caller says that the Brandon team trains in Brookings. What is CERT?
Well, take it, folks.
CERT is a community response program. I know in Sioux Falls it was tied with our fire department, and it's kind of on the neighborhood watch type idea. People are given some basic first aid training. They get provided with a little bit of like a vest, a hard hat, things like that, and they're a resource that a community could draw upon for volunteers if they need a response.
And they have some individual training, and I know I reviewed one of them, was just real smart stuff. Things like house on fire, go back, find the propane tank, shut it off. You know, really good, straightforward, common, everyday stuff. Yeah, I highly recommend it. Yep.
Well, and it brings to mind also the other thing that I heard earlier. All disaster help is local. I mean, it's local. I mean, you said this on a show before. This is a salient message that I got. It's all local. So it's so important to have a neighborhood that you can support and supports you. I was visiting someone whose house was close to another house, and that person was trying to work through getting from one side to the other with a trailer, and had to kind of run across the neighbor's lawn. Well, doesn't know if the neighbor would allow it, and that you can't go over there. And of course, wouldn't it be great if we would all be, hey, can I help you move that? Sure, bring it across my line, my lawn. What's good for me is going to be good for you. And if I give to you, it comes back. That good neighbor policy always works. So get to know your neighbors and know that you can be there to support them and be there to support them if they're in need.
Okay. I got some paperwork given to me. It was stuff that went with that training, the February disaster training, and I skimmed it, but there was a question on here. It says, what's the first priority of all citizens or responders? Are you supposed to protect yourself from danger, provide life support, be ready to deploy to the disaster area, or be able to help in a crisis?
You're reading right off
I am.
National Disaster Life Support Corps course question.
Yeah.
I've heard this one before.
Oh, have you taught this 14 times?
What's the answer?
Well, if you can't protect yourself, you're not going to be any good to anybody else.
Your own life safety.
Okay.
Yeah, it's take the oxygen yourself so you can help your daughter.
Exactly.
If you're dying, then it won't help.
So that's my first responsibility.
Take care of yourself,
and then I can help other people after I've
protected.
Okay.
Which is really the premise behind people need to be individually prepared so that they can help be part of the response instead of part of the problem in a disaster.
So what's a good way of getting us all motivated to take it seriously? Because sometimes it isn't until the floodwater's rising where we go, maybe I do need to get a sump pump,
Well,
human nature.
Don't you think the Boy Scout promise, be prepared? What could be happening? Get ready for the worst scenario and be prepared. Have the water bottles in your basement. And
my experience in rural South Dakota is with our farmer and ranchers, even our more urban dwellers, I think they do a pretty good job.
I think they do too.
Yeah.
We have enough blizzards and ugly weather situations in this state where I think people stay vigilant with it. I do think there's areas where, as time passes, people forget about the disaster and then they get a little lax in what they're doing. But South Dakota's good at taking care of South Dakota.
Yeah. We're getting a good reminder right now, aren't we?
A good wake-up call.
It's a wake-up call.
Well, do you have any stories of patients or experiences that you have had where it kind of somebody's preparedness really paid off down the line?
I can just say virtually any time we have a significant fire issue in Spink County with our volunteer firemen, they're just exactly, that's why it works. They're volunteers, they're self-prepared, they have the communications links all set up. They jump from either working behind a desk or working on the farm, and immediate response and good control. And so they actually practice what I preach. So
I think about the volunteer fire department, and Brookings is a volunteer fire department. All these hours that these guys put in, and it's just unbelievable. Although I do know they have this wonderful camaraderie. I mean, they just love each other, supporting each other. They're there for each other. They know each other well, and it's fun. But it is truly a service for our community. My hat's off to all the volunteers. Firemen and volunteer people who go to help with sandbags and all those things. The volunteers are what makes it work.
Okay. I want to. What are we learning right now from the flooding disasters?
I was thinking about the Katrina deal.
Okay.
Let me ask you that question. The Katrina, apparently, the national government got a black eye for all of that. Why? What did they do wrong, and are they fixing that? Let me ask you that. Do you have any guidance?
Let me address that, because that's, I think, one of the most misunderstood things. How do you declare a disaster? And the way it works is county government is responsible for the request. Now, in my county, that would be Spink County Commissioners or the mayor of Redfield.
Right.
And they make a request to the governor. The governor reviews it. The governor's team reviews it. They make a request to the President of the United States. I don't know where that chain fell apart in the Katrina issue, but it took too much time to get an appropriate response, in my opinion. And I know that's a very politically incorrect thing to say,
Right.
but I think it's true.
Well, the truth is that they didn't get the response, and one always goes to the top and says, well, it was the president's fault. I don't think it was it?
Mm-mm.
No. And so somewhere along the line, the political, no, this is my territory, I'm in charge. You know, you're trying to jump ahead of me. I mean, something happened like that. I can just feel it.
Maybe the lesson learned, I mean, because there is always going to be the territorial issues, is communication, and then communication. You know, we have to be able to talk to each other, know who our partners are in our response, to make a response work.
I think a good example of that was last year during our H1N1 response. The South Dakota Department of Health did just an incredible job with weekly briefings to healthcare providers, clinics, hospitals, physicians.
Yeah, boy.
And it kept everybody on the same sheet of music. It kept everybody understanding that we weren't hoarding vaccine. When we came up with a tier system, who really needed it the most first, we had no issues in my county with people trying to budge the line.
Yeah. And I'll have you know, they said to us 3 days before our show, and by the way, we'd like to do the TV show on Thursday night, and we said, you bet. Don't you remember, or was it 3 days, or was it?
I can't remember, honestly.
We said, sure, here we are. Boom, it went another, you know, we put off that poor Matt Owens, or who else was scheduled for that.
But I may add, too, the CDC also sees it this way, too, and gave South Dakota an award for being the most prepared and most...
In the country?
Yeah.
No kidding.
Yeah.
We had some of the highest vaccination rates in the country with some of our age groups.
It's that Lon Kightlinger guy. I mean, he is effective.
Back to vaccinations.
Back to tetanus shots. Actually, we have a phone call from Selby. Now, a little different spin. Is it necessary to have a tetanus shot before knee or ankle or shoulder surgery?
When's the last time you had a tetanus vaccine?
Gets back to how long it's been since your last.
The issue is not the surgery. The issue is when were you last had a vaccine?
It's been 10 years. Yes.
Real quick, tetanus, we called it lockjaw when I was in grade school.
That's a good way of putting it.
What happens when you contract tetanus?
Trismus.
Tetany.
Yep.
Everything tightens up. You can't, your it's a neurotoxin.
And
so your nerves, instead of relax, they go into constant action. And so all the muscles tighten up.
Pretty high death rate if not treated.
I was going to ask. Yeah. So it's a real deal.
It's a real deal.
Okay.
We haven't had a lot of that around, because people, for the most part, are protected.
Get their shots.
But we get some. There's occasional case, pretty rare.
Okay. Well, was there more about Katrina? I didn't mean to.
Well, I mean, how are they doing? How did they do with Joplin? I mean, did the U.S. come through? I mean, I think I heard the president said, this is not going to be a bad case. We're going to be there. We know about it. Let's go there. Do we have heard
I haven't heard anything as far as anything. It sounds like a very appropriate response. Very good integration. Everything I read, too, on the Mississippi River flooding east of us here earlier in the year, too. Once again, it's that integration of local, state, and federal government. They have to speak. They have to communicate, just like physicians in an emergency room. Who gets the first operating room? The county, state, and federal government needs to know where the resources are needed the most urgently.
Now, there was something that I learned here that I didn't know before. I mean, I knew there was this huge snow melt in Montana that's causing this flooding that's coming through South Dakota. But I didn't know that there was, on top of this, an excessive amount. I heard there was some big rains and we need to be prepared, but I didn't think it was anything like what the melt was going on. What do you know about those rains?
What my understanding was they got almost a year's worth of rain in a month in eastern Montana. I was looking at a website at the Crow Indian Reservation. It's just amazing. The flooding is just amazing, and that all has to go down through, I believe it's the Yellowstone, and then up into the headwaters of the Missouri, and eventually it's going to end up in New Orleans. And it has to come through South Dakota first to get there. So
and flooding all the way down.
If you want to track pictures, disasterrecoverysd.com. I'm trying to remember .gov. That's where you can see the inundation photos or maps and the aerial photography, and it's interesting viewing. I'm sure it's not enjoyable for Pierre and folks that live along the river downstream, but
Well, my heart breaks for those people whose homes are flooded and a helpless feeling. But again, you know, if you're alive, you're alive. You know, we all are worried about our material things, and it's pretty easy for me to say on high ground. But
they just put that website on.
Oh, good. Disasterrecovery.sd.gov. There it is.
Okay. A question from Sioux Falls. Could you comment on the legal part of helping at a disaster for a volunteer? Is there
Okay, we'll go back and clarify. South Dakota does have a good Samaritan law on that.
If it had nothing to do with a disaster, I'm driving along, somebody's on the side of the road. Oh my gosh, I've been told never to move a person because they could have their neck broken, and that the car's about to burn. What am I going to do? And I don't want to be liable. I'll just drive away.
No.
Wrong answer. What's the right answer?
Do what you think a reasonable, prudent person would do. Now, that's for the individual. If somebody is a professional in the healthcare system, whatever that position may be, if they get lined up with ServSD and it's a governor's declared disaster, that actually comes under the South Dakota sovereign immunity laws, which are different than the Good Samaritan law. I'm no attorney, but I've been briefed on that there's a distinct difference between the two.
But I do think that we are very well protected just by doing what is rational and reasonable, even if you're not a trained physician, to do what you think is right. Please pull over the side of the road. Do what you can to help. Get your car out of the road. Don't stop in the middle of the road. Get off the side of the road. Do the right thing. And let's help our neighbor.
Okay. Now, here's an interesting question. It comes from Yankton. They've got something other than flooding on their mind. Comment on radiation emergencies, for example, nuclear and atomic weapons.
Ooh, yeah. Oh, well, let's build another
it's not quite
power plant, shall we?
Yeah, not quite in the headlines like it used to be, 20, 30, 40 years ago.
The little event in Japan kind of brought some of that back forth for us.
Our closest nuke plant's somewhere in Minnesota?
Montevideo,
yeah.
So there's no...
Or Monticello, one of the Montes.
No nuclear power plants currently in South Dakota.
Right, and if there's nuclear weapons, AKA Department of Defense, I'm sure they're pretty well trained to take care of them.
But the issue is, how safe are they from a radical bomber who wants to cause havoc, drop it from a bomb, airplane or whatever? I mean, all these things could occur. I do think we need to know how to handle ourselves with nuclear issues. And then the political issue is, where do we get our power in the future, and should we talk about nuclear? And probably not the place to do it here.
I will just add one thing. I did some look into the dirty bomb thing, and it's more of an emotional thing than any real threat.
The real risk is not.
For its time, distance, and shielding. But stay away from it and protect yourself.
Yeah, take your iodine. Or don't take rock salt, but do iodized salt and let the iodine protect you.
Okay, stick that in the basement.
In that little cave.
That would be the last thing I'd put in my cake.
Iodized salt, you don't care.
Well, you got to make those ramen noodles taste good.
Right.
Okay, a clock is ticking. I think you can give us a quick answer on this one. A question from Sioux Falls. How do the doctors feel about flu shots? Okay, come on.
Answer, Matt.
Well, do you want to cut your risk of being over 65? Cut your risk of hospitalization with pneumonia. What? 40%
or something.
46%. In our facility, actually, it's required of all our healthcare professionals because it is that big of an issue. Yes, absolutely behind. I am the flu shot poster child.
Yep, me too. Very good.
And
you agree?
I was going to say public health is always going to say yes.
And there's a reason.
Yes.
And herd immunity, real quick, Dr. Holm. Explain herd immunity. Why somebody like me should take a shot even though I hate it.
So you protect my children. Because if you don't take the shot, you could get infected and you're going to be spreading it. And the issue is if you got enough people that are covered.
And I can recover, but there's other people that aren't as healthy.
Then you're going to protect people by getting a group of people covered. That's important.
Okay, we've got to wrap up. Ms. Frentz, what final words of wisdom do you have?
Well, from public health, it's always going to be the be prepared. And it is a common sense message. And it's the same message, and we said this in H1N1 that we've always said, use your head, practice good hygiene, be prepared. Okay. Stay safe.
Dr. Owens?
Awareness, and if people take only one thing away from this, in the event of disaster or having to move away or move to a different location, have a good idea what kind of medications you're on, what you're taking, what your past medical history is.
Where would you keep a list on you in your pocketbook? Or
I would just keep it in the glove compartment.
Glove compartment of your car is a good space.
Yep.
All right, so
write down the meds I'm taking and the doses, and
just basic stuff. If you had heart disease or had diabetes, anything along those lines. Data out of Katrina said a lot of hospitalizations could have been prevented if people just knew what meds they were on and when they were supposed to take them.
So I could make my list after the show tonight. And
and you could put it in your glove compartment. That's a good point. Yes.
Dr. Holm?
And I think that this is one show I can't talk a lot about exercising to keep you from having. I can't say a word about it. I didn't. So, but I so much appreciate the two of you for coming, and thank you for being here. That's great.
That's great.
Yes, thanks everybody. It's been a great discussion. Now stay tuned. We'll be right back after the break with the homespun perspective and then what's new in medical science.
Looking for reliable healthcare information online? You can start with the resources link at the On-Call website. From there, you can access a variety of accurate and dependable information sources, including the South Dakota State Department of Health and Medline Plus.
Did you know that 3 out of 4 tornadoes in the world happen in the U.S., and that many of them occur in this neck of the woods? Most frequent experiences occur in Tornado Alley, starting early in Texas and progressively later in the season through the spring and summer, up through Oklahoma, Missouri, Kansas, Nebraska, and the Dakotas. That said, tornadoes can happen almost anywhere and almost any time of the year. A tornado typically forms when a cold front with winds going one way bump into warm, moist air going the other way. The theory is that updrafts on one side and falling rain on the other can start these opposing winds spinning. And when one end of the twisting wind is sucked into the updraft of a tall thundercloud, the speed of the whirling is enhanced and becomes concentrated as it tightens down into a funnel, much like a skater spins faster as the arms and legs come in. About 2% of tornadoes reach speeds of up to 300 miles per hour, causing 70% of the damage. And 70% of tornadoes are minimally destructive, with winds of less than 110 miles an hour. The major rule to protect oneself from tornadoes is to avoid flying debris. Experts advise avoiding windows and not wasting time opening them. If you're in a sturdy, permanent home, go to a lower, central, windowless room, maybe under a stairwell, or climb into a bathtub. Get low, cover with a mattress or a sleeping bag if possible. If you're in a mall or a church, avoid large spaces. Find a hallway, bathroom, or a smaller windowless room and crouch. If you're in a mobile home or a vehicle of any kind, get out, as these are all extremely dangerous in a tornado. In a vehicle, if you can safely drive away, do so. Otherwise, get off the road, get out, and away from anything that can roll over you or fall on you. If you can't find a permanent sturdy building, you're safer in a lower spot or a ditch away from cars or trees. Lie flat or crouch, face down with your arms covering your head. Avoid bridges, as they offer little protection against flying debris. Well, it's wise to make a plan and be prepared, since we live in Tornado Alley. We'll be right back.
In our medical news tonight, researchers at the University of Colorado School of Medicine recently surveyed over 100 elderly individuals and asked them questions about driving. The scientists found that over 70% of those surveyed supported mandatory age-based driver retesting. And while various statistics can be used to debate whether or not older drivers are safer or more dangerous than younger drivers on the road, the scientists in this study say that older drivers do have a high rate of accidents per mile driven, and elderly drivers also have less ability to recover from accidents because of the frailty that comes naturally with getting older. older. One of the researchers involved in this survey says that the time may have come for us to consider the idea of an advance directive for driving. It can be everybody's shaking their head. It can be an uncomfortable topic for children and physicians to bring up with elderly relatives and patients, but a discussion about when an older driver should consider hanging up the keys might raise awareness of current driving difficulties. And on that note, we're just about out of time. Remember, On Call is rebroadcast on SDPB Digital Channel 2, Mondays at 11 a.m. Central and Wednesdays at 4 p.m. Central. Once more, I'd like to thank our guests, Sandy Frentz, Dr. Matt Owens, and our medical editor, Dr. Rick Holm. Thanks to our phone volunteers, and thanks to you for watching and calling in. Have a great evening.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
To learn more about life and health, you can order your copy of The Picture of Health, a beautiful book containing insightful essays and evocative images by On-Call medical editor Dr. Rick Holm and Dr. Judith Peterson. This book, containing healthcare advice, stories of medical history, and meditations on healing, can now be yours for $17 at the South Dakota Ag Heritage Museum. Call 1-877-227-0015 to order. This offer is made by Ag Bio Communications at South Dakota State University.